So you have a health plan, but do you know what services are covered? And are there extra benefits and programs you can use? We'll tell you how to find out on this edition of the Texas Insurance Podcast. Hi, I'm Misty Hino. Today we're talking with TDI's Essie Ergel about how to better understand all the benefits your health plan offers. If you find this information useful, please like and subscribe to the Texas Insurance Podcast and share it with your friends and family. All right, well, thanks for being here with us, Essie. Appreciate you coming to talk about health plans.
Thanks for the invite. I'd love to talk about health plans.
All right. So health plans must cover certain health benefits, right? Tell us how that works.
Yes, you're right. So health benefit plans have to cover certain mandated benefits, and those benefits are described in coverage documents. So that's why it's so important for people to read their coverage documents, whether it's a policy or evidence of coverage. It goes into detail about what is covered and what's excluded from coverage.
Okay. And who can they ask? Can they always call their health plan if they have those questions?
Yes, they can always contact their health benefit plan. They can also contact their insurance agent that they've worked with to secure the coverage. And then also we have resources on our website as well.
So what are some services that people don't know they can get through their health plan?
So some services people may not know that they can get through their health plan is telemedicine, telehealth, and teledentistry, and also free preventive screenings.
Okay, what is teledentistry? I don't think I've heard of that one.
So teledentistry just means that you're getting a service in a place other than the physician's physical location. So anything with telemedicine, telehealth just means other than the physical location of the doctor or dentist. So for example, it could be that a person is online at home using their laptop and they're communicating with their physician or doctor about their illness or ailment that caused them to need an appointment.
Okay. So it could be the phone, it could be online or
Yes.
different location.
Yes.
Okay. And you mentioned free preventive exams. So people can get a free annual exam?
Yes, that's correct. So free annual wellness checks, and that includes screenings for prostate cancer, breast cancer, cervical cancer, certain cardiovascular screenings based on that person's disposition to get that specific diagnosis. So, yes.
Okay, so all those screenings are covered free of charge then every year?
So free of charge.
Okay.
Sometimes with cardiovascular screenings, it may depend on that individual's predisposition to certain like arteries, their structures of arteries, and whether or not certain items run in their family. So that may not necessarily be 100% free, but the other ones definitely, the cancer screenings, breast screenings, those type of things, so long as it's limited to that actual screening in connection with the wellness check. If a person kind of goes into detail like about their chronic health issue or discusses anything other than that wellness check, it can lead to that physician or provider doing a different billing code, which then could lead to a person getting a bill for that screening. But as long as that individual is specifically and expressly there to get the free preventive screening and limits the conversation to that free preventive screening, then they shouldn't get a bill.
Okay, I think I had that happen to me last year. I went in for my free exam and I had a cough. And once I started talking about that, I got a bill.
Yes.
And I called and they explained that. So that's what that was. Okay.
Yes.
That makes sense because that could have been a separate appointment.
Yes.
All right. Okay. And when you're talking about the breast cancer screening, you mean like mammograms, those extra things you hear about that are good to do every year?
Yes,
Okay.
that's correct. Yes.
Okay. What are some other benefits that people usually don't know they can get with their health plan? I've heard there's lots of other cool things we can sign up for.
Yes. So a lot of health plans do provide like wellness programs, and that includes like smoking cessation programs to help people stop smoking, gym memberships tied to certain wellness activities. So there could be an individual can get a reimbursement for participating in a gym membership. Also, there's discounts tied to wellness benefits for co-payments and deductibles. Sometimes those can be waived based on that person participation in a health factor related to their wellness benefit.
Okay, wow. That's a lot. So you would go online to find out these, I guess?
Yes,
Go to your
you
health
could go
plan?
online. Yes,
Okay.
definitely online. Go to your health plan. I'll also say certain diabetes equipment is covered. Other medical equipment may be covered as well as part of those additional benefits.
So what about shots? People get shots every year. Are those covered too?
Yes, a lot of the immunizations are covered. Yes, so definitely the individuals can go in, and sometimes that can be provided by a pharmacy or it can be provided at your physician's office. It's just good to go into detail, or I'll say look at the detail in your health coverage document to make sure that it's covered. But
Right.
yes, it is covered.
And I guess you want to check where you get it too. Can you get it at pharmacy? Can you get it at the grocery store? I guess you want to be sure that you're getting it at the right place, right?
Yes, exactly that.
Okay. Are there any other final thoughts? Any other tips you have?
Um, I'll just stress to the consumer the importance of reading their coverage documents, their policies and evidences of coverage, any communication that comes from their health plan or from their health carrier, just reading those documents to make sure they're familiar with their coverage, familiar with their cost share, their co-pays or deductibles. And if they have any questions, reaching out to the guest services of the health plan, and customer service, I should say, of the health plan, and also reaching out to us, to TDI, if there's any questions about what's mandated for coverage or if there's any surprise billing that individual gets, they should reach out to us because we're also a resource for them.
Okay, so those envelopes you get in the mail and they have numbers on them and you don't know what to do with them.
Yeah.
Call us and we'll explain it to you.
Yes.
Because sometimes we don't know what questions to ask. So it's good to have that person there to
Yes.
question.
Excellent. Yes.
Okay.
I agree.
All right. Well, thank you so much for being here. I appreciate it.
Thank you for having me.
To learn more about how your health plan might cover mental health treatment, watch this video. And if you have other insurance questions, call our helpline or visit our website. Thanks for joining us. We'll talk to you next time.